Hello. Hi, my name's Annie Young. I work half in clinical practice as a nurse in University Hospitals Coventry and Warwickshire, and I work half in research in the University of Warwick as well. So I'm here on behalf of Paxman Scalp Coolers. I have no conflicts of interest whatsoever and no honoraria or anything like that. I think that's important to say. All I want to do is bring more scalp cooling really to our patients in Coventry and in the UK really. So these are the devices. This is a new cap which Paxman have just brought out, and the scalp cooling coolers and the caps are used really to try and prevent hair loss during certain chemotherapy regimes. And you can see the two patients with a double cap machine sitting, so it's just like a refrigerator, and it's a beautiful story because the ex-managing director was involved. His whole family, the Paxman family, are still involved in beer cooling, and his wife got breast cancer, and her greatest concern of having the chemotherapy was hair loss, as it is with many patients, and they devised an early device, and that's nearly 30 years ago. So this is Paxman embracing life. So we want to prevent hair loss, but there's not many chemicals or not many medications around to do that. And scalp cooling seems the best we've got at the moment. So what scalp cooling does do is it vasoconstricts, of course, just with the cold. I mean, rheumatologists are using cryotherapy for knees nowadays. I've seen cooling of nails in oncology patients to try and preserve their nails during chemotherapy as well. So it reduces the biochemical activity and the cell regrowth really, and tries to just stop the chemotherapy getting into the scalp where the hair follicles are really. So we use it in patients with solid tumours. I think as the science works, it's not a million miles away for using in patients with hematological tumours, but they are scared about scalp metastasis as well. So it is increasingly used worldwide. Scalp cooling works, so the cooling bit works, so like all cell cycles, the hair is a cell cycle as well, and it works in the anagen phase, so that's the growth phase of the hair cell cycle as well. It depends on the type and dose of chemotherapy, and we're getting better at targeting patients with different types of chemotherapy and also doses. It works in 50% of all patients that we use it on, and it has to stay on the scalp cap has to stay on the head for quite a long time. This is an actual hair from a patient who's had chemotherapy, and you can see the damage. And this is who's been scalp cooled as well. So you can count how many cycles of chemotherapy this patient's had from the damage to the hair. So it becomes very fragile, thinner, and a different texture whatsoever. And you can see the bigger picture there to show the chemotherapy cycles. You can actually see the cycles of chemotherapy. You can do that with nails as well. You can count the ridges on the nails. So chemotherapy slows down a lot of things. So we're getting better at the science. In order to get the device implemented, we're getting better at the science. So we know much more. This is Ralph Paus, a dermatologist from University of Manchester, who's done a lifetime's work in chemotherapy-induced hair loss as well. So we're getting better at the science. There are some SNPs that have been discovered, and just fishing really for lots of SNPs, in which the patients have 500 times the risk of losing their hair than other patients. So we are getting there with the science. It's an individualized thing, and we have to measure scalp cooling. It's what matters to that patient. So losing half your hair, sometimes that's okay for patients, and with others that's devastating for patients. So we have to measure hair loss better as well. So it's temporary alopecia. Some people say, well, it's only cosmetic, it's not life-threatening like maybe other side effects of chemotherapy like neutropenic sepsis, and wigs are wonderful. So folks say that. But in the news, so this is from Australia. It's in the news that, and this is what we found from interviewing our patients, is that it's a huge reminder of their illness. It's hugely devastating to patients. They lose their sense of self. There's a stigma of cancer, altered body image. So there you go. So it really is a big deal to the patient. Okay. So as for scalp coolers, there's variable use in the UK. We're not so good in Coventry. Most cancer centres have scalp coolers, mostly bought by a charity, and there are some exceptional centres like Huddersfield that offer it to all their appropriate patients, every patient that comes through the door. Lots of nurses say they don't have time, they don't have space, they don't have, and they don't believe in it either, really. So research funding is tricky. Where the centres that use it best are situated, they integrate it into their whole patient pathway, and it's just part of care, really. Why are the machines not used? There's been research into this. Because the doctors are worried about effectiveness and safety, and the nurses are generally worried just about space, really, in their chemotherapy unit as well. So as the science and the outcomes improved, and we do need better trials, and we're trying desperately to do that. So we are carrying out trials at the moment. You can see that Paxman has treated over 100,000 patients. So we just need to promote it. This is where scalp cooling's used worldwide, and I think the yellow is the yellow's best. I thought, wait, can you see the Netherlands there? They're much better than the UK, but we're in the same ballpark. And the FDA are just about to give authorization to Paxman for scalp cooling device. And there's another company that already have FDA approval, which is really good as well. From there, this is where the scalp coolers are, and I think they need a few more in Scotland and Northern Ireland. And you can see what the patients have been saying over the decade, that hair loss, written in red there, is always one of the top 5 concerns of having chemotherapy as well. So our greatest strength is our patient voice, and our patients are out there fighting for us as well. Not fighting for us, no, not at all, but they're out there highlighting and marketing scalp coolers as well. These are just some of the quotes. My husband, and it was the only thing that affected him when I lost my hair, he couldn't stand looking at me without my hair. So we've done lots of qualitative studies. We're now into trials, and we have a better measurement of, we've just done a measurement of hair loss study called Mesolo, along with our international colleagues from the Netherlands, and we need to get it into NICE guidance as well. So just finally, alopecia is underestimated. It's important, extremely important to many patients. I think everybody understands that. Scalp cooling works, but not for all patients, so we have to target our patients better. And there is no sign of a higher chance of scalp metastasis at all with lots of prospective and retrospective studies. So we need to get better at implementing, and thank you very much indeed on behalf of Paxman.